Hanaoka Seishū, the pioneer of general anesthesia. Hanaoka Seishū, 1760 to 1835, was a prominent Japanese surgeon and physician during the late Edo period. He is celebrated as the first person in the world to successfully perform surgery using general anesthesia, decades before its widely acknowledged introduction in the West. His pioneering work, combining traditional Japanese and Chinese medicine with Western surgical knowledge, marks a major milestone in medical history. Early life and medical training. Born in 1760 in what is now Wakayama Prefecture, Hanaoka came from a family of physicians. His medical journey began by apprenticing under his father. Kyoto studies. At age 22, he traveled to Kyoto, the then center of Japanese medicine, to further his education. He studied with Dr. Nangai Yoshimatsu, a respected practitioner of traditional Chinese herbal medicine. Dutch learning, Rangaku. Crucially, Hanaoka also acquired knowledge of Western surgical techniques through Rangaku, or Dutch learning, as the Netherlands was the only Western nation allowed limited trade and cultural exchange with isolated Japan during the Edo period. This fusion of Eastern herbal knowledge and Western anatomical surgery became the foundation of his revolutionary work. The quest for general anesthesia. Inspired by ancient Chinese legends of a physician named Hua Tuo who used an anesthetic called Mafutsusan for surgery, Hanaoka was driven by the desire to alleviate the agony of surgical procedures, which were excruciatingly painful at the time. Developing Tsūsensan, Mafutsusan, Hanaoka spent years researching and developing an effective anesthetic. He experimented with various medicinal herbs, focusing on the Datura alba plant, which is known to contain powerful alkaloids like scopolamine and atropine. He eventually perfected his oral anesthetic, which he called Tsūsensan, or Mafutsusan. Human trials. The development process was arduous. After rigorous animal testing, Hanaoka needed a human subject to confirm its efficacy and dosage. In a tragic but dedicated act for science, his mother and wife volunteered for the trial. While accounts vary, his wife, Kay, is famously recorded to have lost her eyesight as a result of the experiment, a testament to the high cost of this medical breakthrough. The historic surgery. Hanaoka's efforts culminated in a monumental achievement on October 13, 1804. World's first, he successfully performed a mastectomy, breast cancer removal, on a 60-year-old patient named Kan Iya, using Tsūsensan to induce general anesthesia. Precedence. This operation occurred approximately 40 years before the public demonstration of general anesthesia using ether in the United States, a feat often, though erroneously, cited as the world's first. Hanaoka's isolated location and Japan's self-imposed isolation meant his work remained largely unknown to the West for decades. A prolific career. Following this success, Hanaoka went on to perform over 150 breast cancer operations and many other complex surgeries, including lithotomies, bladder stone removal, and various plastic surgeries, all under general anesthesia. Legacy. Hanaoka Seishū's contributions extended beyond the operating table. Surgical innovation. He is credited with designing and modifying numerous surgical instruments. Education. He established a medical school at his residence and trained hundreds of students, passing on his philosophy that modern surgery and traditional medicine should be unified for better patient care. Hanaoka Seishū is rightly hailed as a true pioneer of modern surgery and anesthesia. His groundbreaking work fundamentally changed the possibilities of surgical treatment and laid a foundational stone for the practice of painless surgery globally.